Have you ever felt a tingling in your fingers or toes that just wouldn't go away? Maybe a burning sensation in your feet at night or a weird buzzing under your skin? These might seem like minor annoyances. But what if they're actually your body's warning signs that something deeper is going wrong? Nerve damage is one of the most misunderstood and underdiagnosed health issues in people over 50. Millions suffer from it, but most ignore the early symptoms until it's too late. In today's video, you'll learn the 7 early signs of nerve damage you should never ignore. These warning signs can show up in subtle ways, long before a doctor gives you a diagnosis. Catching them early could mean the difference between a quick fix and a lifetime of pain, weakness, or even loss of mobility. If you're over 50, this video is for you. And if you've ever wondered whether those strange sensations in your body are something to worry about, this is your wake-up call. If you're ready to protect your nerves, restore your strength, and understand your body's warning signs, hit the like button, subscribe, and comment below with a 1 if you've ever felt any unexplained tingling or numbness, or a 0 if you've never noticed anything. Your comment might help someone else take action today. Let's get started. Sign number 1, tingling or pins and needles. It might feel like a slight buzzing or like your limbs are waking up after falling asleep. But when it becomes frequent or persistent, it's time to pay attention. This sensation is caused by nerves misfiring, sending abnormal signals even when there's no stimulus. It can happen due to nerve compression, poor circulation, or nutritional deficiencies, especially in vitamins B1, B6, or B12. It might start subtly, just a tingle when you're lying down or while typing. But if left unchecked, this can progress to numbness or even burning pain. It's your body's way of telling you your nerves are struggling. What to do? Start tracking when and where the tingling happens. Is it at night after sitting too long? And check your B vitamin intake, especially if you're vegetarian or over 60. Sign number 2, numbness in the feet or hands. Have you ever stepped out of bed and felt like part of your foot was missing? Or touched something and barely felt it? That's numbness, and it's a major red flag. Numbness is a sign that your nerves aren't communicating with your brain. The protective myelin sheath around the nerve may be damaged, or the nerve itself may be compressed, inflamed, or dying. This is extremely common in people with diabetes, poor circulation, or who take certain medications like statins or chemotherapy drugs. Why is this so dangerous? Because when you lose sensation, you're more likely to injure yourself without realizing it. You might cut your foot, not feel it, and develop infections. You might not feel heat or pressure properly, increasing fall risk or causing burns. What to do? Get your blood sugar and circulation tested, and consider supplementing with B12, especially the methylcobalamin form, which supports nerve regeneration. Sign number 3, burning pain, especially at night. If your feet or legs feel like they're on fire, especially when you're resting or trying to sleep, this could be a sign of nerve inflammation or deterioration. Burning pain often shows up in the lower limbs and worsens at night when circulation slows and inflammation peaks. You may feel heat, a crawling sensation, or even like you're wearing invisible socks made of fire. This is common in peripheral neuropathy, a condition where the peripheral nerves are damaged and start firing erratically. It's especially prevalent in people with diabetes, autoimmune diseases, or after viral infections like shingles. What to do? Look into anti-inflammatory foods like turmeric, omega-3s, and ginger, and speak to your doctor about nerve-calming supplements like alpha-lipoic acid or acetyl L-carnitine. Don't wait. Burning pain means your nerves are already under serious stress. Sign number 4, muscle weakness or instability. If you've noticed you're having trouble climbing stairs, getting up from a chair, or opening jars, this may not be just muscle loss. It could be your nerves failing to activate your muscles properly. Nerves are the messengers that tell muscles what to do. If they're damaged, muscles don't get the signals they need. This leads to weakness, even if you're still trying to stay active. You might find that your grip is weaker, your legs feel heavy, or your balance is off. Maybe you've started dragging your feet slightly or swaying when you walk. This can be a result of motor nerve damage, and it's often misdiagnosed as simple aging. But when nerves weaken, muscles atrophy from disuse, and the decline gets worse fast. What to do? Get a grip strength test or gait assessment, and consider adding resistance training and nerve-supporting nutrients like magnesium and CoQ10 to your daily routine. Sign number 5, hypersensitivity or pain from light touch. Imagine your socks feel too tight even though they're loose, or the bed sheets hurt your legs, or you flinch when someone gently brushes your arm. That's called allodynia, and it's a powerful sign of nerve trouble. In a healthy person, light touch should feel gentle, but when the nerves are damaged or misfiring, your brain interprets normal touch as pain. This hypersensitivity can be constant or come in waves. It's a hallmark of nerve inflammation or central sensitization. When the nervous system becomes overly reactive, often due to long-term stress, injury, or disease. You may also feel heightened pain responses to mild pressure, temperature, or vibration. What to do? Try calming your nervous system through breathing techniques, light movement like Tai Chi, or anti-inflammatory herbs. And speak to a specialist about tests for small fiber neuropathy, the kind that affects pain and temperature-sensing nerves. Sign number 6, balance problems or frequent falls. Have you started stumbling more often? Do you reach for the wall or furniture when you walk? Feel unsure on stairs or curbs? Your balance might be off, and nerves are often to blame. Balance is a complex function that involves your inner ear, vision, muscles, and most importantly, your sensory nerves. These nerves tell your brain where your feet are, how your body is positioned, and how much pressure you're applying. When nerves are damaged, your brain gets faulty or delayed information, which throws off your ability to stay upright. You might not feel where your feet are on the ground. You might trip over nothing, or sway when standing still. One of the most underappreciated causes of falls in seniors is nerve damage, especially in the legs and feet. What to do? Don't wait for a serious fall. Talk to your doctor about nerve testing and strengthen your proprioception with balanced training exercises like standing on one foot or using a wobble board. Sign number 7, sudden shocks, jolts, or electric zap sensations. Do you ever feel a sudden zap in your arm, leg, or spine, like a jolt of electricity that comes out of nowhere? This is a classic symptom of nerve compression or degeneration. It happens when nerves are pinched, inflamed, or have lost their insulation, the myelin sheath. These zaps might last a split second or a few minutes. They often happen when turning your head, twisting your spine, or even after sitting too long. Sometimes it's related to sciatica, where the sciatic nerve is compressed in the lower back. Other times it may indicate cervical radiculopathy or even spinal cord inflammation. Electrical sensations are often dismissed or misdiagnosed, but they're serious, and they're a cry for help from your nervous system. What to do? Get evaluated for disc herniation, spinal stenosis, or vitamin B deficiencies, and take action early. The longer nerves stay compressed, the harder it is to recover. Bonus sign, loss of coordination or fine motor skills. Are you dropping things more often, struggling to button your shirt, trouble typing, or holding small objects? Loss of fine motor control is often a late-stage sign of nerve dysfunction, especially in the hands or feet. It means the nerves are struggling to communicate rapidly and precisely, and your movements become clumsy or delayed. This is especially common in carpal tunnel syndrome, diabetic neuropathy, and B12 deficiency. What to do? Don't just blame aging. Seek testing for nerve conduction and vitamin levels. Early treatment can often reverse the damage, but only if caught in time. Let's recap the 7 early warning signs of nerve damage. 1. Tingling or pins and needles in hands, feet, or legs. 2. Numbness or loss of sensation, especially in the feet. 3. Burning pain, especially at night. 4. Muscle weakness, difficulty climbing stairs or lifting objects. 5. Hypersensitivity or pain from light touch. 6. Balance problems, frequent stumbling or falls. 7. Sudden zaps, electric shocks, or jolts. And the bonus sign, loss of fine motor skills or coordination. These symptoms can appear slowly and subtly, but they're your body's way of whispering before it starts to scream. Here's the good news. Nerve damage is not always permanent. The nervous system is incredibly adaptable, especially when supported with the right tools. A nutrient-rich, anti-inflammatory diet, consistent movement, and gentle strength training. Supplementation with key vitamins like B12, magnesium, and alpha-lipoic acid. Breathwork, sleep, and stress reduction to calm the nervous system. If you've noticed any of these signs, even occasionally, don't ignore them. It's easier to stop nerve damage early than to reverse it later. Let this be your motivation, not your fear. If you've experienced any of these symptoms, drop an 8 in the comments to let us know you're taking charge of your health. Or comment, "I'm listening" if you've had nerve symptoms and are ready to make changes. And don't forget to subscribe. This channel is your place for health, strength, and smart aging. Built on science, not hype. Your body is talking. Now's the time to listen.